How do COPD patients identify their personal triggers? Imagine waking up one day feeling more breathless than usual and wondering what caused it. That's often how many people with chronic obstructive pulmonary disease find their triggers. It all starts with paying close attention to what happens before, during, and after those episodes. Patients often keep a simple diary or log where they note down their symptoms like coughing, wheezing, or feeling more tired. They also jot down what they were doing, where they were, and how they felt at the time. For example, if someone notices their cough worsens after being around smoke or dust, that's a clue. They might also notice that cold weather makes their breathing harder or that their symptoms flare up after a cold or flu. Many patients look for patterns by tracking these episodes over days or weeks. They ask themselves questions like, did I breathe in fumes today? Or was I outside in the cold for a long time? This helps them see which factors seem to set off their symptoms. Sometimes they notice that physical activity or stress makes their breathing worse, which is also important to know. Healthcare providers play a key role here by asking detailed questions during visits. They might ask about recent changes in environment, habits, or health. Some doctors suggest using symptom questionnaires to get a clearer picture of how severe symptoms are and if they're getting worse. Because triggers can be different for everyone, personal observation is the best way to find out what affects each individual. For example, one person might find that dust from cleaning triggers their symptoms, while another might react more to weather changes or infections. Once they identify these triggers, they can take steps to avoid or reduce exposure. This might mean quitting smoking, staying indoors on very cold days, or wearing masks when doing chores that stir up dust. They might also use air purifiers at home or avoid crowded places during flu season. In the end, recognizing personal triggers is all about paying attention and making small changes. It's a continuous process of learning what sets off symptoms and adjusting daily routines accordingly. This helps prevent sudden worsening of symptoms, known as exacerbations, and keeps living well with COPD within reach.